All right. Okay, we're going to begin with a video, and I'm going to share that right now.
Fortunate enough to have full health coverage for myself through my job. I have 4 teenagers, and I am not fortunate enough to be able to afford to purchase that same health insurance for them. I do make little enough to qualify them for CHIP. My oldest is now 19, so he is no longer eligible for CHIP. He receives Medicaid, which I am thankful for. But if any of you know anything about CHIP or Medicaid or private insurance, you know all about jumping through hoops. And over the years, as my insurance coverage for my children has changed, we have had to change providers, which sometimes is no big deal, but when you're talking about mental health, it's a big deal. The continuity of care for mental health is even more important than for any other area. And I have experienced firsthand the devastating consequences of not having continuity of care, having long waiting lists, especially once my children were on a CHIP and now Medicaid. You can't just go see a psychiatrist. The waiting lists are months long. And if you want to see a psychiatrist, you have to also see a therapist, with also long waiting lists and lack of communication between the two. Just finding somewhere that accepts Medicaid or CHIP can be a challenge. It has meant serious consequences for my son with his mental health. And we have spent many nights overnight in the ER trying to get mental health care for him, because the only way really to move beyond the waiting lists is to go to the ER and say that you're suicidal. So even though my son wasn't, he was in severe distress, however, the only way to get care for him was to go to the ER, where he did not receive adequate treatment. He experienced callous doctors who were not trained in dealing with mental health emergencies, and finally was only admitted to a facility by saying he was suicidal. And once he received care, several times he's been inpatient, was discharged to an aftercare program that seemed fantastic, and that the facility told us would take his insurance. However, after being in that aftercare facility, we realized no, they didn't. So now I have a bill that is unpaid, and I don't know how I'm going to pay it because it's not covered, and there's nothing I can do about it. I just want you to imagine a country where every person had quality, free access to mental health care. How many fewer people would be struggling? How much less crime there would be? How much less domestic violence? Fortunate that my son's issues haven't led to criminal activity or any physical danger to myself or my family or to him. But he's only 19, and I fear for his future, and I fear for the future of all people struggling with mental health, especially those that don't have any coverage. There is absolutely no reason that every person should not have complete, full, quality, free mental health care. I'm begging you to support the cause for single-payer health care. I'm begging you to urge legislators to support this, because it is the only way forward. As long as there is a profit incentive, which there is with private health companies, we will not have the care that we need. So please support the movement for single-payer health care, get involved on a local level, and continue to push your legislators for my son, for your own family, for the good of everyone in our country. Thank you.
Okay. Hello, everyone. I want to welcome everyone to our webinar tonight, Single-Payer Healthcare, what it is and why we need it. I'm really glad you could join us tonight, and I want to welcome all of our friends and co-sponsors. My name is Sue Caskey. I'm the chair and the co-founder of Progressive Montco. We're a group of community activists focused on policy that will make better lives for our families and our neighbors here in Montgomery County, PA, and across the state and across the country. Tens of millions of Americans are dealing with a broken healthcare system. We know at Progressive Montco that the people who benefit the most from that broken healthcare system, and a broken political system too, while we're at it, are not the people who are going to fix it. It's up to us to make the change that we want to see in the world. We believe that healthcare is a fundamental human right and that the best way to provide it is through a single payer healthcare plan. At the end of tonight's webinar, I'll be talking about what specific steps you can take that will help to make that change happen and ways that you can fight to win Medicare for all. I'll also talk about how you can work to build power with us in Montgomery County for progressive policy changes. But right now, we're going to introduce some nationally known experts who are going to talk about what single payer healthcare is and how we can achieve it. This webinar tonight is the first of a planned series that we're working on to talk about key public policy issues that affect all of us and what we can do about them. So right now, I'd like to introduce Jamie Malley. He is our lead organizer for Progressive Montco's Medicare for All working group, and he's going to conduct tonight's discussion. So thanks again for joining, and be sure to stay tuned at the end to learn how you can work to make Medicare for All a reality. So Jamie, take it away.
Thank you, Sue. Good evening, everyone. As the nation's health and economy continue to suffer from the impacts of a pandemic, and with the possible election of Joe Biden and a Democratic Congress, it would be good to understand the healthcare reforms which will likely be presented next year. In light of the wheeling and dealing between corporate interests and Congress during the creation of the Affordable Care Act, we feel the public should have a better understanding of what may transpire this time around, and perhaps more importantly, how such reforms will impact their health and economic security. A significant majority of Americans continue to support the adoption of a Medicare for all single-payer healthcare system. Unfortunately, this continued support fails to make it onto the policy agenda, largely due to the misrepresentations and falsehoods put forth by financial and political interests opposed to such systemic change. Progressive Montco is committed to fight for the healthcare we need, not merely accept what is allowed by the powers that be. We want the public to advocate for the most robust of reforms that will protect all Americans and ultimately lead to a national single-payer healthcare system. This evening, I'm honored to be joined by three distinguished advocates for systemic healthcare reform for a conversation about the future of healthcare policy in the US. We'll begin by addressing the problems of our current system. We'll explain what single-payer healthcare is and what it is not. And we'll consider the merits of Vice President Biden's healthcare plan. And then we'll talk about the disconnect between popular support for single payer and political enactment. I encourage you all you viewers on Zoom and YouTube to share your questions and stories in the chat room. Okay, introductions. Wendell Potter is a former health insurance executive whose experiences caused a crisis of conscience as he became disgusted with America's broken healthcare system after years of helping the industry mislead Americans. Wendell left his job at Cigna in 2008 and has become a vocal critic of the health insurance industry. A leading advocate of reform, he formed the Center for Health and Democracy, which works to transform America's system of health coverage and confront the corruption of money in the political process. He's a New York Times best-selling author and author of books including Deadly Spin, An Insurance Company Insider Speaks Out on How Corporate PR is Killing American Healthcare and Deceiving Americans, and Nation on the Take, How Big Money Corrupts Our Democracy and What We Can Do About It. Mark Dudzic is the national coordinator of the Labor Campaign for Single Payer, whose mission is to ensure that the voice of the grassroots labor movement is heard in the debates over the future of healthcare. Their affiliates include 15 national unions and hundreds of local and regional labor organizations. Mark has been a labor activist for 40 years, serving first as president of his local and then president of his district council of the Oil, Chemical, and Atomic Workers Union. He has also served as the national organizer for the Labor Party, fighting to advance occupational safety, promote working class culture, and win national health care. Thank you for joining us tonight, gentlemen. So Dr. Walter Tsou is supposed to join us. I'm hoping he'll join in soon. But but we're going to get on with the program because we have about 3 weeks of discussion that we're going to try to fit into 90 minutes. Rachel offered a very interesting healthcare story, and we're going to start off this evening. Oh no, first I'd like to ask you guys. And Mark, why don't you go first? You've been at this for 40 years, and 40 years in the labor movement, you've seen incredible change over those 40 years. What was it about your experiences that led you to support a single-payer healthcare system?
Well, in the mid to late 1980s, we started seeing increasing employer resistance at the bargaining table to maintain the level of healthcare benefits that we were able to negotiate and bargain for. It used to, when I first joined the labor movement, it was pretty much a pro forma thing. When you went to bargaining, maybe you could get improve your dental plan, get eyeglass coverage or something, but there was no real talk about moving backwards on healthcare. And that really changed in the mid 1980s. And it was a central part of concession bargaining. So in 1988, we actually invited a guy named David Himmelstein, who was a founder of a newly founded group called PNHP, Physicians for National Health Program, to speak at our district council meeting. And he kind of, opened up this whole perspective about a different way of looking at healthcare, as a public good rather than as a insurance product linked to employment. And it really motivated us to investigate this. By the early 90s, there was a change in some accounting rules, which forced many workers off of retiree health coverage. And, this was just so shocking to me that an accounting entry could determine whether, people would have access to health insurance. It didn't change the cost or anything. It was just because of this accounting rule. People were thrown off health plan at their most vulnerable time. So anyway, in the mid 90s, we organized a bus trip to Hamilton, Ontario. We put a bunch of local leaders on a bus. One of our Canadian sister unions hosted us, and we toured the Canadian health plan. And we came back, we passed a resolution at our national union convention, and I haven't stopped since.
That's excellent. Wendell, you, sir?
I became increasingly aware of what happens to people who have insurance. I worked for Cigna for 15 years, most of it in Philadelphia. And by the way, I lived in Montgomery County for most of my time at Cigna. So my kids went to Lower Merion High School. So I really appreciate this opportunity to be at least virtually back in Montgomery County. I live in Philly now. During the latter part of my career at Cigna, I was expected to be, among other things, a cheerleader for high deductible plans. And I knew it was an industry-wide strategy to move every last one of us into a high deductible plan. And I knew, even though I was supposed to be vocally supportive of these plans, that they would not be good for people who have low and moderate incomes. But I also was the person who was responsible, my team and I were responsible for handling what we referred to as high profile cases. And by this, I mean when someone was denied coverage for something that their doctors said they needed, from time to time, we would get calls, often from reporters who would be asking, why was Cigna not covering a particular thing that in many cases the doctor felt would save their life? And in late 2007, I got a call from a reporter in Los Angeles who was asking me why Cigna was refusing to cover a liver transplant for a 17-year-old girl, Nataline Sarkeesian, whose doctors felt she would have a great chance for surviving, living a healthy life if she had that liver transplant. But a Cigna medical director in Pittsburgh, 2,500 miles away, said, in his opinion, just after looking at some paperwork, that he didn't think it was medically necessary or medically appropriate for Nataline. It became a huge, huge PR problem for the company because the family was able to get a lot of media interested in that story. I ultimately was able to persuade the leadership of the company that this was becoming a big PR problem for Cigna. Ultimately, the company decided to reverse course and approve the transplant. This came as The family was staging a protest in front of Cigna's regional offices in Glendale, California. It was being covered by CNN. So once the company made that decision based on this bad media the company was getting, I had to get the word to the family somehow that Cigna was going to pay for the transplant. And I was watching on national TV when I saw someone from Cigna's office in Glendale whisper in Mrs. Sarkeesian's ear that Cigna was going to pay for the transplant. The family was just, they were celebrating on live TV. And I thought I'd done something maybe helpful to that young woman. I have children of my own, and I could just imagine what the family was going through. Unfortunately, I got a call 5 hours after that Natalie had died. During the space of time that her doctors said and requested coverage for that transplant, she had gotten sicker, and she was not eligible for a transplant by the time that Cigna said it would cover it. And she passed away at the age of 17, 10 days before Christmas. So that was it for me. I had handled so many of those kinds of inquiries in my career. I was just truly fed up with trying to be an apologist for an industry that I knew was contributing to so many problems of cost and access. And I knew too that the industry's tactics were solely to maximize profits. And the industry has erected barriers to care that have only gotten worse since the Affordable Care Act was passed. I advocated for the Affordable Care Act. I think it has done a lot of good. But I said at the time that it was passed that we had to see that as the end of the beginning of reform, that we've got to go much further. One of the first people I reached out to, by the way, when I made that decision to leave Cigna, and that case, that Natalie Sarkeesian case, was the straw that broke the camel's back for me. I turned my notice in just a few days after she died. I began reaching out to advocates to find out if there might be some role I could play in pushing for healthcare reform. And one of the first people that I reached out to was Walter Tsou. I remember so vividly that Walter was intrigued. I was still working at Cigna at the time, so I had to do this very quietly. So Walter and I met at a restaurant in Chinatown, Penang restaurant. I'll never forget it. And that was the beginning of my thinking about how to become an advocate. Frankly, I never thought I'd have the nerve to do what I ultimately did, which was to become a whistleblower and a critic of the industry, and to testify before Congress during the debate on what became the Affordable Care Act. But Walter played a significant role in that, and so did PNHP, because Walter's a longtime member of PNHP, which Mark referenced. So that was kind of it for me. I know all too well the problems that people with insurance have in getting the care that they need, whether it's financial or whether a medical director or a nurse or someone at an insurance company will say, no, we don't agree with you, doctor. We're not going to cover that treatment or that medication that you think your patient needs.
Well, we're glad you had the willingness to become a whistleblower and tell us what really goes on inside the industry. And that was timely appearance, Dr. Tsou. Welcome to the program. And
I apologize, really.
That's all right. That's all right. The question that these nice gentlemen just answered was, what was it about your experiences that led you to support single payer healthcare? Now, I didn't give your introduction, but you could include that in your answer.
Well, thank you for this invitation. I should start off that I was, like most medical students at the time, unschooled on anything about public health. And after I finished my residency, I figured I would go into private practice in some wealthy suburb somewhere, and someone would take me in. And what I found is that nobody was willing to put their arm around my shoulder and say, would you join my practice? And so a few of my friends said, why don't you work at a public health clinic in Philadelphia and do that for a while, and then you can, maybe someone will put their arm around your shoulder and invite you in. So I thought I had nothing else to lose and what happened was I worked in a public health clinic in West Philadelphia, and every day a patient would come in and say to me, you know, doctor, if I'm just so glad that you're my physician because I really don't know how I'd pay for my doctor visit or I would pay for my medicines because I really can't afford it. And what occurred to me is that this entire segment of our society that was going to public health clinics for their care, and you and I and everyone else was going to private doctors for our care. And we had institutionalized, if you will, sort of like this medical apartheid system in this country where those who are poor, those who are uninsured, overwhelmingly minorities, were shuttled into these public clinics. And thank God that we actually had clinics like this that would offer them care. But the point here is that uh, I got very curious about why is it that we have a healthcare system that is, you know, really a two-tiered system for one set of people and another for another set. And after what I thought was going to be a one-year stint doing public health clinic and then going into private practice, what I realized is that, you know, I really have been transformed by this experience that, you know, I want to actually do public health. I think these people deserve care, and that I wanted to devote my time. So what was a one-year stint became a 9-year stint. And after what do people do who decide that public health is really their career? They go to public health school, and that's what I did. I quit my job, took a year off, went to get a master's in public health. And when I came back, I decided that what I really want to do is actually work on public health programs for the city of Philadelphia. And I can give you a long story, but the long and short of it is that I wanted to actually do a mammography program because at that time, back in the I guess it would be late 80s, 1980s, there were, you know, women could not get screening mammograms, believe it or not. The only way you could get a screening mammogram for women was to lie and say, I feel a lump on your breast, and therefore it would be classified a diagnostic mammogram. That's how the insurance companies sort of try to save money for themselves. And then screening mammograms, you just couldn't do it. So my first program working was to try to get a screening mammogram for poor women in Philadelphia. And the long and short of it is that we did succeed. And what I realized is that, you know, you have to go through all these enormous hurdles, particularly for poor women in our country, to get what I consider a basic right for them is to get detected for something like breast cancer. And after that experience, believe it or not, I was having fun doing that. A friend of mine called me up and said, you know, the largest county in America that has no health department is a place called Montgomery County, Pennsylvania, which ironically enough is what you guys, many of you are there. And he said, would you like to start a health department with me? And I thought, what? This is like, he said, this happens once in your life. You get a chance to start a health department. And I thought about it. He said, you know, he's probably right. I never would have a chance like this. But I was, you know, I was sort of dedicated to taking care of many of the poor people in our health centers. And he assured me that there were a lot of poor people in Montgomery County. It may sound rich on paper, but there are a lot of pockets of poor people. And that convinced me to leave Philadelphia and come help start the Montgomery County Health Department. So back in 1990, there was no health department, and we started it, you know, and that actually turned out to be one of the great experiences of my life, is to help try to create and shape a new health department from scratch, the largest health department at the time in the country that did not exist. And we did it with the mission of trying to make sure that the poor and the vulnerable could actually get some type of access to healthcare in Montgomery County.
Well, we're glad in Montgomery County that you did undertake that effort. And I'd speak for a lot of people. We're very proud of our health department in response to the pandemic. Our commissioners and health department have done a wonderful job. I wanted to start talking about what is wrong with our current system. You guys have covered a lot of it, but let me just read a short list of, I was sitting down trying to put a list of these problems together, and I wrote, we by far have the highest per capita cost among industrialized nations. Millions remain uninsured or underinsured. Pharmaceutical prices are higher than anywhere else in the world for the same exact drugs. By law, the federal government cannot even negotiate or regulate prescription prices for those on Medicare Part D. We rank among the worst developed nations in respect to healthcare outcomes. We have escalating premiums and out-of-pocket costs. There's geographic scarcity in respect to healthcare services. Businesses face a huge financial burden and an impact to their competitiveness here and around the world. I'm going to stop there. I realized after I wrote this list that these are problems, but they're really symptoms. What are the problems that cause these symptoms? That's what I'd like to address. Mark, would you like to start off?
Sure. I mean, somebody like Walter, I don't know who it was, taught me that you look at healthcare with like the three pillars. It's quality, accessibility, and cost. And, you look at the system we live under, and you look at the cost, which is twice as much as the OECD, the average of the industrialized world. Then you look at what we get for the cost, the quality of the system, and we rank, 35th, 40th, somewhere pretty low on all of the outcomes, and especially outcomes that involve kind of public health issues, diabetes, those type of diseases, as opposed to rich people's diseases. And then you look at accessibility, which at the best, we got down around 25 million people without any health insurance under the peak days of the Affordable Care Act. Another 50 million who think they have health insurance until they try to use it and they find out that it's so expensive that it doesn't keep them out of bankruptcy. Those numbers now are up around 100 million. So the fundamental problem with this healthcare system is that it treats healthcare as a commodity that's linked to, that's for sale in a marketplace, rather than as a public good that needs to be made available to everybody under the same terms and conditions and financed in an equitable system of public financing. That's a fundamental problem. And, on top of that, we have this screwy system that links healthcare to employment. Nowhere else in the world is healthcare linked to employment. Half of the people in this country access healthcare through an employment-based healthcare coverage. And it was an accident of history. For many people, for many years, it was kind of a second best alternative to a national health program, but it produced relatively good outcomes for a lot of people for a lot of years. But even in its heyday, it was just a spectacularly bad idea. I mean, you lose your job and you lose your healthcare benefits. I mean, why would you want to link your healthcare to your job? Your kid ages out, your kid loses her healthcare benefits. And, it reinforced the inequality from the very beginning. We have always had a tiered labor market, and the tiers were often structured by race and gender. And so, there was different accesses to healthcare based on this tiered and unequal labor market. So it built in inequality. And then even, and then the system began to deteriorate, as I said, in the 1980s. If you look at US outcomes and costs and stuff, somewhere around 1980, we radically diverged from the rest of the industrialized world. And so the system began to deteriorate. So, even before the pandemic, this system was clearly unsustainable. It was, we're looking at the average cost for a family of four for healthcare of $28,000 per year for a family of four. And, that's $14 per hour for a full-time worker. And if you've ever sat across the bargaining table from an employer, you can know that $14 an hour is a pretty impressive number that you have to bargain for, even if you're bargaining for high wage workers. And imagine if you're trying to organize low wage workers, people who are making less than $14 an hour in wages. And that employer knows that if the union succeeds, not only will they have to pay those workers a living wage, but they're going to have to come up with that kind of money for sustainable health care. It really shows why it's so hard for workers to unionize in this country. It shows how healthcare costs have driven wage stagnation for the last 25 years, especially for the lower half of the demographics. And it's clearly an unsustainable system. The costs have been going up twice as fast as our wages for a long time. And if you draw that out on a graph, you'll see that those lines are going to cross pretty soon. And at that point, as they say, if something can't go on forever, it won't go on forever. We're coming close to that point. And then you have the pandemic.
Will it go on?
I'm almost done, but I just got to.
No, bring up the pandemic. That's good.
1 million workers a week are losing their jobs and losing their access to employment-based health care. 1 million workers a week since March have been losing their jobs, losing their access to health care. There's no way that we can see that this system can sort of be reestablished in a fair way when this pandemic ends. I mean, workers will never forget how precarious their healthcare coverage is after living through this period that we're living in now. So we're really at a flex point in terms of healthcare. And I'm sorry I went on a little too long.
No, that's fine. It was wonderful stuff. Wendell, you've written a couple of books that are related to they tie into the structural issues that plague our system, and you started Business Leaders for Healthcare Transformation. What are some of the structural issues that you'd like to highlight that cause the problems in American healthcare?
Well, basically, it is a healthcare system that is driven by profits and, frankly, driven by greed. That became so clear to me. For 10 years while I was at Cigna, among the things that I did was handle financial communications for the company. I had to know how the company made money, what happened to it, because I would get calls every 3 months from reporters who wanted a bit more information about the company's quarterly earnings report. And I realized that it's all about what shareholders want. And it's not just about health insurance. It is, our system has grown to be profit obsessed. Our hospitals increasingly are owned by companies that have their stock traded on the New York Stock Exchange, certainly pharmaceutical companies. So we're unique in the world. The other thing that we're unique in the world, and as Mark mentioned, our employer-based system is an accident of history, and you can say the same thing, frankly, about our entire healthcare system. Those of us who are of a certain age can remember a few decades ago, when most health insurance companies operated on a nonprofit basis. That began in the Great Depression, when a hospital administrator in Houston decided to try to increase occupancy at his hospital, and he came up with this idea of offering hospital insurance to people who lived in the Houston area, starting with teachers. That idea was successful. It did drive business to the hospital. It ultimately became something that other hospitals around the country decided to model. That was the beginning of the Blue Cross system. And for many years, the Blue Cross system operated as all the Blues were nonprofits. They adhered to community rating. They didn't discriminate because of race or gender or age or health status. But then, as Mark mentioned, in the 1980s, things began to change. And big insurance companies like Cigna and Aetna decided to get into the business. They saw an opportunity to make some money, and some big money. And that's what happened. And the companies that I work for, Humana and Cigna, make enormous profits. They've grown by mergers and acquisitions primarily. So that's what has happened. We have a system that we turned over to Wall Street. Every other country in the developed world had at least an effort to create a national health system. But we didn't. We had attempts, even Franklin Roosevelt thought about it, thought it wasn't possible, or he had other things he wanted to do, and just took that off the list. Harry Truman tried it, but the American Medical Association at that time was adamantly opposed to it and torpedoed that plan. And so every effort over the years has been killed by huge special interest. And in recent decades, the special interests have pooled their money. And I used to participate in organizations that took advantage of that pooling of money to develop campaigns to keep reform from happening.
So that's sorry to interrupt, but structurally, how does that prevent, I mentioned earlier at the beginning of the program about the disconnect between public support for single payer, or they used to call it universal health when I was a kid. It's been popular for my whole lifetime, yet there's a disconnect with the political world and the political agenda. Why don't I go to Walter for a second? Maybe you can address that. What from your perspective, what is structurally, what prevents that desire or that popularity of single payer system to come into play? You sit on the board of, or you're a board member of Physicians for National Health Program. Doctors used to be against this type of program, and now doctors are starting to believe that single payer or Medicare for all is the way to go.
Well, I'll start with a story. I went to my 35th medical school class reunion, and one of the survey questions that they asked all of us was, what kind of healthcare system do you support? And 61% of my classmates said they supported single payer. That was kind of a shocker for me. But so what it does show, though, and a lot of surveys show this, is that contrary to what people think, actually, quietly, the majority of doctors realize that the system stinks and that we would be better off under a single payer system, because frankly, when a patient comes to you and says, I have problems, the first thing you should not be doing is a wallet biopsy or a immigration biopsy. You should be saying, what can I do to help you? And I think that's how we want to practice medicine. And single payer would offer us that opportunity, I think. So I have a lot of questions out there, so I don't want to belabor my comments. I can
That's okay. I want
go
to
on for hours.
I think you all could. Wendell, I interrupted you. What is it about the campaigns by the insurance industry or the medical device providers or the pharmaceutical companies? What is it about those campaigns? How do they impact the political system and block the popularity of single payer healthcare? How did you do it at Cigna? You're muted, Wendell.
You do it in ways that it's entirely behind the scenes. No one knew my name back in the 1990s and 2000s when I began this work. The entrenched special interest, the insurance companies, the big hospital chains, the pharmaceutical companies, device manufacturers, as I said, they come together. And I would meet with my peers at companies throughout healthcare that in one way or another, we were opposed to change. And we would spend enormous amounts of money in various ways. One is through propaganda campaigns to get people to believe things that just simply are not true. And I learned that you can do that pretty easily, certainly if you have the money to spend. And if you just repeat a message over and over and over again, tell lies and half-truths, which is what we did. That's how it works. And then you couple that with all the money that the big insurance companies and drug companies and hospital companies, the AMA, spend to influence elections. That's why I wrote Nation on the Take, was to help people understand this is how it works, folks. They spend huge amounts of money. During the debate that became the Affordable Care Act, the drug industry spent more money in one single year than any industry has ever spent on one piece of legislation. It's about $275 million just on lobbying. And
that would provide a lot of health care for Americans.
Yeah, no kidding. And just think about that was adding to that is the money the insurance companies spent, the hospital industry. So it was a huge amount of money. And you work with PR firms, you work with trade associations to develop strategies to get people to believe things that aren't true. I've written a lot recently about the work that we did to scare people away from the Canadian style healthcare system. That is something that's always been very scary to the insurance industry, because if we had a system like Canada's, there would be no need for the insurance industry as it exists right now.
Let me go to Mark for a second. I want to try to give equal time here. Mark, I've already seen in the chat probably 5 times. Is it true that labor unions don't support healthcare? Some of my fellow members of the Democratic Party insist that laborers don't like healthcare or single-payer healthcare or Medicare for all. Is that true?
Well, I'll tell you, last year, for the first time since the 1990s, unions that represent a majority of organized workers in this country endorsed the HR 1384, the House Medicare for All Act of 2019. So I can state that the policy of the majority of the labor movement right now is to support Medicare for all. Now, I also have to say that there has been some significant backtracking on the part of national labor leaders, sort of in the during and after the primary debates as they prepared for the general election. And I think most of that is driven by the politics of the general election and what they feel they need to do to support the candidates and deal with the existential threat of another Trump administration. But look, there is some significant pushback that you get within the institutional labor movement around these issues, and I've noticed some of the questions. I guess there is some thinking that that it provides a negotiating healthcare provides a reason for unions to represent workers, a union advantage, as they call it, and that unions would be weaker if they weren't able to do that. I think more and more people realize that that's just the opposite, that we're tired of coming after every contract negotiations and explaining to our members why we just had to agree to a higher deductible or one of Wendell's freaking high deductible health plans or whatever the latest concession is on healthcare, that we'd be a lot stronger if we, didn't have to negotiate for basic healthcare. Likewise, unions that have health and welfare funds, have a real institutional stake in continuing that. But again, those funds are also in crisis. And, the pandemic has certainly made that much worse. I mean, if you represent people in the entertainment industry with 90% unemployment, or the hospitality with 70% unemployment, these funds just can't continue under these circumstances. And again, there's alternative visions to how you could run a real union advantage health and welfare fund if you didn't have to negotiate $12, $13, $14 for every hour worked for basic coverage. You could reallocate some of that money to real union advantage programs like child care and elder care and legal services and educational benefits and enhanced unemployment coverage. So there's a lot of ferment right now in the labor movement thinking about how we can overcome this. And the other argument that we've often heard, and we hear it less and less, is that the members aren't ready to support Medicare for all, that it's too divisive, that the members don't want it. And that has changed. I think the Nevada caucuses, I think, was a real crucial wake-up call for the institutional labor movement when a large and very good union, the union that represents most of the casino workers in Las Vegas, they call it the Culinary Union, said that we're going to lose our health benefits if we support Bernie Sanders because he's for Medicare for all. And a majority of the members of that union supported Bernie because he supported Medicare for all, because they understood, because they were good union members and their union was a good union. They understood, number one, how precarious their benefits were, and number two, that they weren't just casino workers, they were part of a working class, and their friends and their neighbors and family members needed the same rights to health care that they were able to achieve from decades of tough bargaining. So that's, that was a real wake-up call, that people began to see that the members want it, that it's a chain, an anchor around our neck, and that we need to begin to move forward. So I think the post-election period is going to be a real interesting moment for the American labor movement.
I'd like to move just quickly, because I promised a lot of people that we would talk about the public option and we would talk about the likely policy environment for healthcare with the Biden administration. But just quickly, in maybe a minute and a half, 2 minutes apiece, if you could sum up, Walter, why don't you start by telling us what are the advantages in perspective, or what are just in your mind, what are the advantages to a single payer or Medicare for all system?
Well, we're seeing in the middle of the pandemic the problems of having an employment-based private health insurance model. As Mark just pointed out, I mean, when tens of millions of people lose their their employment, and just like a month later, they're going to be losing their health insurance benefits. Just in the middle of a pandemic, you can't possibly create a worse system in the world. It just makes no sense at all. So the real advantage of single payer, I think, is that it's with you from cradle to grave. If you can fog a mirror, you're in the system, and it covers you. And a lot of these eligibility nonsense that we have to go through right now, whether, depending on what plan you're in and so on, determines what kind of doctor, what kind of hospital, what kind of health benefits you get. These terms that are uniquely American, pre-authorization, in-network, out-of-network, all this stuff doesn't exist in other countries. And so I think, the simplicity of trying to simply get care for people is the strongest argument for single payer. I'll let other people comment.
Wendell?
Yeah, I'll pick up on what Walter said. Not only do you have universal coverage and coverage that goes with you from cradle to grave, you don't have the things about private health insurance that people have come to absolutely despise. And Walter referenced them. Sometimes it's prior authorization. That's what happened to Natalie Sarkeesian. People don't realize that in private insurance companies, that's where the real death panels are. We heard that term in the debate on what became the Affordable Care Act as a scare tactic to try to make people think that the government was going to be creating death panels, that they exist, and they exist within private insurance companies. The insurance companies have the power to make decisions that affect someone's life and determine whether they're going to live or not. Also, these networks that Walter mentioned, private insurance companies, every last one of them has a defined network, and they exclude doctors and hospitals. You don't have that in our traditional Medicare program. And you don't have high out-of-pocket cost in any other country as we do in this country. Increasingly, people are saddled not only with premiums that go up every year, but also with high out-of-pocket costs, deductibles, co-payments, co-insurance. And that is one of the big barriers. It is why, as I think Mark mentioned earlier, or alluded to, we have about 100 million people who either have no insurance or, almost just as bad, they have insurance but they can't use it because they don't have enough money in the bank to cover the deductibles before, to pay for the care that they need.
So, Mark, do you want to add something quickly? You kind of covered some of that before.
No single thing could enhance the security of working class Americans like a Medicare for all system. It just, you think about how to make life more secure and stable for working class Americans. It's a Medicare for all system, and it opens the door to addressing a whole range of inequality and racial disparity, both in healthcare and throughout society. And it changes some of the power dynamics that make working people have to live under the thumbs of big corporations.
So a question I have, well, actually, let me start by saying that I looked at President Biden's, or Vice President Biden's healthcare plan, and I got to say, it'll give Americans more choice. It'll reduce healthcare costs. It'll simplify the system. It lowers the age of enrollment for Medicare. Offer a public health insurance option, which is a public option like Medicare. Negotiate lower prices for hospitals and other providers, and no co-payments. There's a couple other things, but those are the major planks in his plan. Will this make everything better? Or Wendell, you and I have talked before about the evolution, or the evolutionary tendencies of the health insurance industry. Why don't you start this time? Will a public option mitigate the problems that we've just discussed?
Well, first of all, the health insurance industry will fight that very fiercely. They don't want to have more, really don't want us to have more choice, even though they use that word a lot in their propaganda to make us think that's what we need in this country more than anything else. They conflate what we really value, which is choice of doctors and hospitals and healthcare facilities, healthcare providers. We are increasingly bewildered by the having to make an informed decision about a health insurance carrier. And in many cases, we don't even have that choice if we get our coverage through the workplace. A public option would not get us the savings that we need. It will not get us to universal coverage as a single payer healthcare system, what is Medicare for all. You can argue that it would get us maybe further down the road. But when you're creating a system that has one additional choice, you're giving up the benefits of single payer. When you have a single payer system, you are able to eliminate so much of the wasted spending in our system that is caused by having multiple payers. All the insurance companies spend enormous amounts of money on overhead and increasingly on profits and advertising, executive compensation, paying people like me to do work that's not necessary. So you can eliminate that with a single payer healthcare system. A public option would, if it's done right, could bring a lot more people into coverage, and hopefully would be a system that would be a plan that would be developed that would not have a lot of out of pockets and have broader choice if it's based on the Medicare program. But still, you have that fundamental problem of having this incredible inefficiency in our healthcare system.
Walter, a public option, I have to say that it must be in some ways better than what we have now. So that's good going forward. If the political scenario I talked about earlier before you joined, that Vice President Biden wins the election and there's a Democratic Congress. But what are your thoughts on public option versus Medicare for all?
Well, Wendell probably knows more than I do about this, but the public option, at least the way I had originally heard about it, works for the marketplace, the healthcare marketplace, for people who have individuals trying to get health insurance and have only a choice of private health insurance companies, many of them with astronomically high deductibles. And the public option would be a choice among those who have it. But if you have employer-based health insurance, which most people have, you're not going to benefit from the public option itself, because it's really for individuals who need to get health insurance and their employer doesn't provide it. At least my understanding of how the public option would work. So it benefits a small minority of people who could use it. That's not to say that it's a step perhaps in trying to expand the role that government could play in healthcare. There are other things that they've talked about: lowering the age of Medicare down to 60, trying to negotiate with drug companies for better health prices. These are things that ostensibly we would try to also do with a single payer plan is to not just 60, but actually everybody. But arguably, it's sort of this incremental step. But what it doesn't solve is the administrative overhead. The hospitals are still going to have now a new insurance company, if you will, the public option that they can send their bills to. But it doesn't save them a whole lot of billing people. In fact, they probably adds to more billing people that they have to deal with now. And so the administrative efficiency that you would like to see from a single payer plan, it won't materialize with a public option.
Mark?
Yeah, well, I mean, I think they pretty much covered the problems. The centerpiece is the public option. There's a lot of other good proposals, a laundry list of proposals that the Biden campaign has laid out around healthcare, around women's healthcare, expanding rural healthcare. It's a lot of good things there. But, it's all premised on the preservation of the commodification of a public good under healthcare. It doesn't break the link between employment to healthcare, although Walter, to Biden's credit, the public option would be an option that employers could buy into. Not just available on the exchange, which is a little different from the traditional public option. But nonetheless, it doesn't break those ties. The inefficiencies mean you don't have the cost savings that you would have. And this is what really drives me crazy. Why the hell do the Democrats always bargain against themselves? I mean, why don't we start with what we want instead of starting for what we think the other side will accept? Because, once you do this, and any shop steward would know this instinctively, once you start bargaining from the boss's demand sheet, we're only going to go downhill from there. And we started in 2008 with a public option as the vision, and we ended up with this system that now is going to have 100 million people with no health insurance or unusable health insurance. So, let's start with what we want and make a clear case to the American people for why we need this healthcare system and begin to move it on that direction.
All right, so all of us are in agreement about that. But there's the thing about the policy process, and when you get to go back out on the streets and the streets of DC, Mark, and the halls of Congress, you're going to run into a whole bunch of other fellows and women, and they're going to be telling the people, the 435 in the House and 100 in the Senate, a different story. Wendell, when we first spoke about this, we talked about, and I wanted to talk about this a little later, but we're there. You talked about the necessity that if the only political outcome that will come out of negotiations is a public option, that the business community must be protected, and that it is the most robust forms of public option that we could put together. Sounds easy. This all sounds easy to me, but as I used to tell my AP Gov students, there's a lot of interests, there's a lot of power, there's a lot of representation. How easy will it be to even get the most robust public option in place?
No, it'd be terribly, terribly difficult. And I was a reporter in Washington many years ago, so I saw at an early age how policy really is made, and ultimately in the insurance industry was a part of influencing public policy. It's extraordinarily difficult, and that is because they spend so much money, as we talked earlier, to influence elections and are able to influence how bills are written. One of the things that became very apparent to me when I was in Washington as an advocate for reform 10 years ago is that there were very few of us who were representing patients and consumer advocacy organizations, but there are, multiple times that of lobbyists who are well paid and who are constantly going from office to office. So it's very, very difficult. But I will say that what Mark said is absolutely correct. This time is going to be a bit different because unlike 10 years ago, there really is strong support for Medicare for all. more than half of the Democratic caucus has signed on as sponsors of that legislation. That was not the case back in 2009 and 2010. So I think we have champions that we didn't have before. It's not going to be easy by any means. You can rest assured that the industry, and I'm not talking about just the insurance industry, but the hospitals and the drug companies will throw money at trying to keep even the public option from happening. But those of us, if that is what we wind up, if that's a path we go down, we've got to be very, very forceful in making sure that we're holding members of Congress their feet to the fire. We need to have as they say, a very robust public option. It needs to be a plan that does not saddle people with high out-of-pocket costs. It needs to be open to employers and their employees, and it needs to be operated out of the Medicare program.
So, Dr. Tsou, the Democrats have talked about it as being a stepping stone. Public option could be a stepping stone to ultimately having a single-payer system, but it seems to be that we'll be prolonging some misery along the way. Will we be able to get a handle on costs and that quality of care that I guess Mark mentioned that you talk about this before? Will those things improve for American citizens?
I think the jury is still out as to whether adding a public option will, reduce our costs. I alluded to the idea that actually there's now a new insurance company, if you will, that hospitals can pay toward, and they may have to negotiate in the same way that they did with some of the private insurance companies. So I don't know whether your hospital bills will go down because we now have a public option. I also am not sure actually if the quality will necessarily be better under the public option. I think that what happens is, in sort of this for-profit world we have, everyone sort of races to the bottom rung of trying to provide care, and it's going to be there are questions as to whether that will improve quality. So that's also the great fear, I should tell you, about people say about single payer. Oh, your quality will be terrible. You'll wait forever and so on. People should understand that single payer is a financing mechanism with the idea of how we try to deliver the care. And I would write a single payer bill, frankly, to talk about what kind of delivery we want. We want one where you get really quick care to high-tech, high-quality services at an affordable price. That's what people want. And that's how you should write the delivery system, frankly, and then figure out the cheapest way to pay for it, which I believe is going to be a single payer model rather than this multi-payer private insurance public option model, which we're trying to impose on the American people.
Mark, the labor campaign for single payer, what are your thoughts, and how do you, what are your plans for approaching this policy debate in Washington?
Okay, well, I just want to comment on, the public option, as a transitional movement into Medicare for all system. I think the opposite happens. I mean, you have to understand the sort of dynamics of a commodified for-profit healthcare system. And as Walter said, it's the race to the bottom. Medicare for seniors in 1965 was going to be a transition to a Medicare for all system by the people who first promoted that. And look at it today. We have a third of the Medicare recipients have been torn out, the healthiest, most profitable ones, into Medicare Advantage programs, commodified healthcare. The system has then been severely restricted in terms of what it covers and what it doesn't cover, underfunded, and it's going to be in crisis. So the dynamic actually works in the opposite direction. When you create health, you allow profit to drive public goods, profit will push you into a race to the bottom. It's sort of inevitable that happens. So in terms of, what does the labor campaign look at the possibilities here? I think, first of all, there are facts on the ground that don't change, and will, as Wendell said, will really drive the politics come January of 2021. These facts are just realities in people's lives. There's been a huge sea change in people's perceptions and demands for healthcare justice in this country, and it has sustained, pushback. A couple 5 years ago, you could say that support for Medicare for all was a mile wide and an inch deep, and that as soon as you started saying, well, you're going to lose your own coverage and Canada and blah blah blah, people would flee that system. And nowadays people are much more sophisticated in why they support healthcare and or support Medicare for all, and it's going to sustain itself. So that's going to drive the politics. And then finally, I would say that really, and people have alluded to this, the fight really isn't in Washington. The reason we don't have Medicare for all isn't because we don't have smart policy proposals. I mean, every freaking country in the world has figured out how to make healthcare a right to everybody. The reason we don't have it is that the medical industrial complex is the biggest, most profitable industry in the history of capitalism. And this is a fight against entrenched corporate power. And the political power follows and responds to that entrenched corporate power. So, what we are going to have to do, and this is why our fight is so hard, is, we have got to, take on this massed corporate power that stands between the American people and their healthcare. It ain't going to be easy. New folks are coming into town in Washington. There's another gang of newly elected or soon to be elected Congress people who ran on Medicare for all and have a mission in Congress. You have people like Pramila Jayapal who have a vision that the Progressive Caucus ought to begin to start acting like a real caucus in Congress. And we will see what we can do to help move those forces on the ground.
Wendell, I want to ask you, go back to from the employer-based system. It's been kind of floated about out there that anybody can join this public option. But say a corporation of 500, 1,000 employees, are the corporations going to let their employees walk out of that healthcare plan to join the public option? To me, it seems that there would be some resistance there. And how's that going to play out?
It'll play out differently depending on the size of the company. If it is open to employers and their workers, I can assure you that most small businesses and many mid-sized businesses would embrace this. I know this because the Business Leaders for Healthcare Transformation, which I lead, every one of our members supports Medicare for all. We can't get that if the public option is second prize. They want to make sure that it's open to them and their workers. So I think you would see that. Keep in mind that most small businesses are not able to offer coverage to their workers anymore. Over the years, the number of small businesses offering coverage has declined. And so that puts them at a disadvantage when you're trying to recruit and retain talent. So I think you'll see it'll be different depending on the size of the company. The biggest corporations, you'll see the greatest resistance because, again, they do have an advantage when it comes to hiring and keeping employees. And I think you will see, though, even some of the big corporations saying, why do we stay in this? This is not core to our business. Why do we have to spend so much money having a large staff of people to be involved in trying to provide meaningful health benefits to their workers? So I think you'll see even some executives of large companies begin to peel off from the status quo and embrace change. I'm seeing it happen. I talk to employers all the time at all levels of size, and I think that we'll see that employers will. The final thing I want to say is they're not monolithic. The U.S. Chamber of Commerce, the National Federation of Independent Business, has largely tried to carve out that they speak for business. They don't. And that's why I started this organization called Business Leaders for Healthcare Transformation with other business leaders.
Cool. Walter, would you like to comment?
Well, one of the questions in the chat has to do with how we're going to win this battle. And I actually think when small and mid-sized businesses, and they come from small towns and rural areas, and they march in and say to their congressman, "Listen, I can't afford health insurance for my employees anymore, and it's killing us." And uh, it's the most unpredictable part of my budget is I can't figure out how much I'm going to pay for health insurance next year. I think, if enough business people did that in some of the poor, in some of the more rural parts of this country, I know some of our Republican colleagues might say, this is a big issue on Main Street in small town America. And I can't ignore it anymore. And it's when the business people, I think, help transform this debate to one that's perceived not as a socialist plan, but one that's actually patriotic and job affirming and trying to put America first. That I think we will have a change in this discussion about Medicare for all.
Okay, I'd like to talk more about that fight, how we're going to go forward. But one of our members, Claire Joanowitz, she put together a video with her healthcare story, and I want to get that in so we don't use up all the time. So Sue, if you're ready to play Claire's video, this is just a minute and a half, and then we'll get back at it.
All right.
Hi, my name is Claire Janowitz. I was diagnosed with breast cancer in March of 2019. I was lucky enough to have enrolled in Medicare in November of 2018. So I had just enrolled in Medicare when I was diagnosed. And thank goodness, because I don't think I'd be here today if it wasn't for Medicare. I had previously had private insurance. I was self-employed, and I did not ever get anything easily from that private insurance. They argued with me every time I needed a test. This was prior to my breast cancer diagnosis. So I know that when I had my breast cancer diagnosis and didn't have Medicare, I literally feel like I would not be here today. Medicare was fabulous. They paid for everything. No arguments. When my oncologist said I needed extensive chemo, they paid for it. Extensive radiology and surgery, Medicare paid for it. And I don't see why everybody shouldn't have the opportunity to have such fabulous health care in this country. Everyone should have Medicare for all. And I think it's so important. We need to get this on people's radar. People need Medicare for all. If I should have had it and was able to get that fabulous health care, everybody should. Thank you.
All right, I want to thank Claire for her testimonial, and also for Claire is one of the people who were responsible in getting our working group together last summer and autumn to meet with Madeleine Dean's staff to talk about Medicare for all. A lot of the talk that went on during the primary season. Medicare for all. What's the difference between Medicare for all and Medicare? I mean, is one better than the other? Walter, you're smiling. Go ahead. And we only have 14 minutes left, and I have a couple other questions. So let's try to just shoot through this. Go ahead, Walter.
Well, Medicare starts at age 65. Medicare for all would start at birth, and that's the big difference.
What about in terms of coverage, though?
Well, if we started at birth, we would obviously include a whole range of new, prenatal and infant services that are simply not part of Medicare right now. So it would be transformative in terms of the type of benefits that Medicare offers. It would, in Canada, they call their health insurance plan Medicare, but it has a very different meaning because it actually is not just for 65 and older. The other thing I think it's worth noting in Claire's comments is that if people think private health insurance is so good, and when you turn 65, you don't give up I mean, you're happy to give up your private insurance to get on Medicare. I don't see anybody saying, "Oh, I don't like Medicare. I'm going to stick with my private insurance plan and keep paying premiums to keep it going." It doesn't happen. So,
All right, we have about 13 minutes. Thank you, Walter. We have about 13 minutes. We know where the battle will be, but what do we need to do here in Montgomery County, in Philadelphia, throughout the nation? There's a lot of nice people tuning in from Oregon, Louisiana, Texas. What do we need to do? What do we need to do to either influence the development of the most robust public option that will lead us to single payer, or convince people that single payer is the way to go? Mark, you want to start?
Sure. I think there's two immediate tasks that we got to do legislatively. If once this election is over, number one, we've got to pass the Healthcare Emergency Guarantee Act, which will provide emergency healthcare relief for every American in the midst of this pandemic. It'll have Medicare pick up the bills for every uninsured American and pick up the co-payments and deductibles for people who are still have private insurance. We need to do that as part of a bailout. It'd be an economic stimulus as well as a humanitarian program. And that puts us on the track of laying out a vision of what healthcare ought to be in this country. Second thing we have to do, assuming that we take the Senate, is we have to fix the Senate, because the path for Medicare for All has to move through the Senate. We have got to fix the Senate. It's arcane rules that are were meant to reinforce a racist oligarchy in this country have got to be eliminated. We've got to get rid of this filibuster and fix the Senate. And then in terms of looking at this from an organizer's perspective, we have got to do what we in the labor movement call inoculation. I like to say that we're at this point now in the fight for Medicare for All, very similar to that point in the union organizing drive right before the boss finds out about the union in the shop. People are all united, they're ready to move forward, but they have not yet experienced the absolute reign of terror and the hell that will be directed at them by people like Wendell's associates who live to create the confusion and dissension. So we've got to inoculate people. We've got to prepare them for the arguments that will be used against us so that they understand that when those arguments are used, where they're coming from, and they're gonna tell us, it costs too much. They're gonna tell us that we're gonna have rationing. They're gonna tell us that the government can't do anything right. They're going to tell us that a bunch of freeloaders, like illegal immigrants, will get our health care, and that we'll be paying for health care for IV drug abusers and people who eat too much or whatever. And then they're going to tell you that we're going to lose what you have. This fear of losing what you have is often, a much more powerful persuader than the hope of gaining something that you need. So these are the kind of issues that we've got to get right down in Montgomery County and everywhere in America, and begin to engage our neighbors, our co-workers, and our families around, so that when the fight comes out, that people are prepared to move this forward. We've got to build an army that understands what we're fighting for, and then we got to come up with the political strategy to win it.
Wendell?
Mark is absolutely right. I won't repeat what he said. I would just reiterate, it's very important to inoculate the public, to make sure people understand what's coming down the pike. I've said that what we're going to be facing is the mother of all propaganda campaigns after the election, because the industry will be throwing everything it can to try to scare people away from reform. That happens every single time. They just recycle the talking points that I helped create many years ago. The other thing is to support organizations that are in this fight. Support Progressive Montgomery County, Progressive Montco. Support Mark's organization. Support Physicians for National Health Program, Healthcare Now. There are a number of organizations that support moving forward in a very progressive way, and they need to have more members and more financial support. Check out Business Leaders for Healthcare Transformation if you are a business person, and join us in that effort. The Center for Health and Democracy, I chose the word democracy. That's another organization I lead, because we also need to do work in helping to reform our corrupt political system. Mark's right about needing to change the way the Senate operates. we need to change the way our political system broadly operates. So spend as much time as you possibly can supporting change to lobbying reform and campaign finance reform.
Dr. Tsou, you might have what end up being the last words, but we'll see how long everybody wants to stick around. Go ahead.
Well, I totally embrace what Mark and Wendell have just said. You know, this is probably the battle of all battles to get a single payer plan for this country. But I believe in the end, it will be worth it. It is because, as Mark had said earlier, there's so much inequality in our society. And the great leveler could be through the mechanism of actually a Medicare for all single payer plan that's paid for through progressive taxations. I actually think that you can join the business leaders, as I had mentioned earlier, and nothing could be more transformative for Madeline Dean, I think, in Montgomery County than to have a group of business leaders come into our office and say, we want to talk about healthcare. We want to talk about why it's killing us and why you need to support a single payer plan, because in the end, getting this albatross off the back of business leaders, I think it's going to be transformative for their businesses. They don't want to spend their time figuring out the health plans for all their employees. I think they want to spend their time making the products and services that they created their company for in the first place. And I think that's where we need to move to.
Mark, thoughts?
Yeah, I mean, the Philadelphia area has these three nice liberal Democratic Congress people, Representative Scanlon, Representative Evans, and Representative Dean. There should be no reason why they're not on Medicare for all, and we need to really move them. That's a real task for folks on the ground. You know, I think there's a lot that community-based organizing can do. I'm a founding member of our revolution here in Howard County, Maryland, that we've kind of come up with a political strategy. You can really have influence. There's a group of unions in the Philadelphia area that have committed to working to move those three Congress people. You know, you could bring, if you brought a business person in, I'm sure we can bring, they can find a union representative who will accompany them, and we can build a powerful movement. But let's move these folks who should be on our side. There's no reason why they shouldn't be on our side. And there's no, you know, they're not going to lose the next election because they're fighting for health care for all. They're not vulnerable in that way. So we got to move them. And, you know, the kind of organizing that Progressive Montgomery County is talking about is the real lever to begin to move that on the ground.
Wendell, final thoughts?
You know, one thing, the organizations that are national, but I would love, Walter is exactly right. Members of Congress will respond differently to business owners and small business owners. I'd like to explore maybe with folks on the call about starting local chapters of, for example, Business Leaders for Healthcare Transformation. It makes a very big difference to have local folks going in to meet with a member of Congress. Makes all the difference in the world.
Walter, you were last here. Now you get the last word. I said it before, but go ahead.
Well, let me say how much I appreciate the opportunity to have my friends Wendell and Mark on a call. I feel honored to be part of this. And I think, you know, you had asked in the very beginning, your first question I wanted to respond to. If you were the board of directors out there listening, and I was the CEO of a company, and I said to you, I have a plan, a product that actually leaves 30 million people out of the system, costs 40% more or 50% more than any of my competitors. And the quality is so bad that actually our life expectancy is worse, maybe 3 or 4 years worse than other European and Japanese countries. What would you do as a board of directors? You probably would fire me. You'd say, this is a terrible business plan you've come up with. Why would you promote something like this? And I think that's what we should do as an American people. We have a system that we have invested in because we don't know how to control it. And it's a terrible plan, frankly. And it's time to really start over and ask ourselves what could be a better plan for this country, and one that actually achieves many of the goals that we have seen in the 21st century about trying to address racial inequality, access to health services, and a better quality of care for everybody. And I think that's what single payer offers as a promise.
Well, I have to say it's been an honor to have you all here. I love the camaraderie you have from knowing each other and working on the same cause for years. I want to stress to our listeners, we at Progressive Montco are willing to take on that fight just to educate and help you learn more about the options that'll be on the table come January, if we're, hopefully in that situation. If not, the fight's bigger, but please join us. Thank you, folks, or thank you, gentlemen. And I hope to be able to do something like this or run into again sometime in the near future. Thank you for helping us out. Appreciate
Jamie.
it.
Thank you.
Now I'm going to turn it over. We're back to Tsou, and she's going to have some comments.
Hi, everyone. Oh, my camera is really bright red. Sorry about that. I just want to say thanks again to all of our speakers. Just amazing. This is the kind of thing that you just don't hear in the mainstream media because there's no time to explain in detail how this stuff really works. I also wanted to thank our co-sponsors and also our members who shared their healthcare stories with us tonight. It was all very powerful. If you've joined us tonight, I'm going to guess that you want to make sure that the policy is going to work for people and not the privileged few. So we're going to send everyone who registered a follow-up email, and we're going to list all the resources that our speakers spoke about tonight and also resources that you can use in your area to get involved in this fight for single-payer health care. One ask that I'd like to make from everyone tonight is we do need support and we do need resources. Tonight we're starting our very first fundraising campaign for Progressive Montco. We want to be able to bring more educational events like this one out to the public, not just in Montgomery County, but across the country. So we'd like to ask you to please support us by making a donation now, if you can, at our website. My co-chair, Tsou Stout, is dropping a link in the chat. We would appreciate any donation in any amount. It will help us continue to build these types of events in the future. For our Montgomery County resident, and I would like to say, in response to some questions, we are going to be posting this on YouTube. So in that email that we send out, we'll include links to everything. You can also just Google Progressive Montco on YouTube. For our Montgomery County residents, I wanted to let you know that this coming Friday is our monthly call, and I'd like to invite all of you to join to learn about all of the action we've been taking and the big action that we have planned, not just between now and November 3rd, but afterward, because this is going to be a big fight. And we are working with our partner organization, PA Stands Up, and all of our co-sponsors to make sure that Medicare for all and all of our progressive agenda is on the table when we help Biden win on November 3rd. So the last thing I'll say, speaking of that, is we want to emphasize we can't make this happen if Trump is reelected. We're asking everyone on this call, even if you're not in Pennsylvania, PA is a critical state. We would like to get all hands on deck to help our partner organization, PA Stands Up, with their text and phone banking. They'll be doing massive get out the vote for PA voters. Tsou is dropping that link in the chat as well. You can join those calls from anywhere. And in fact, we've kind of been adopted by Pramila Jayapal's district, so we are thrilled. Thank you, everyone from her district who might be here tonight. I want to thank everyone again for joining us tonight. We'll send that follow-up email shortly with all of the links. Please be sure to like and share our YouTube. And remember, in November, everyone, it's up to us to demand Medicare for all and policy for the people, not profits. Thank you, and have a good night.
Good evening, everybody.